At Carepatron, we are constantly looking at ways to improve. If you have any feedback on how we can improve our videos and resources, please leave us a comment in the comment section below. SOAP notes are helpful methods of documentation designed to assist medical and mental health professionals in streamlining their clinical notes. Using a template such as SOAP notes means that you can capture, store, and interpret your client's information consistently over time. SOAP notes are a specific type of format structure for progress notes. This form of clinical documentation aims to track the improvement of patients, facilitate better communication between members of a patient's care team, and provide evidence for insurance providers. SOAP notes separate information into 4 relevant sections. Subjective. The subjective section covers how the patient feels and what they report about their symptoms. The main topic, symptom, or issue that the patient describes is known as a chief complaint. Direct quotes from the patient are often included, as well as their symptoms and how the problem impacts their day-to-day life. Objective. The objective section includes the practitioner's observation of the patient's behavior and effect. It should also include details regarding any tests, examinations, scans, or laboratory screenings completed during the session. Assessment. The assessment is essentially a synthesis of the subjective and objective sections, where the practitioner evaluates the patient's condition. It is where the practitioner analyzes or interprets the patient's complaint, how they responded to treatment, and whether they are progressing towards their goals. Plan. Finally, the practitioner writes the patient's future treatment details in the plan section. These could include upcoming sessions, referrals, changes to the treatment plan, and any short or long-term goals. Now we will go through how to use our general SOAP notes template, using an example from one of our guides. Firstly, access and download the template. You can access a blank SOAP note template by clicking on the link in the description or by exploring Carepatron's template gallery. Fill out the details. The next step is to document patient information, which involves assessing the patient's condition, medical history, and physical examination findings. You must fill out the SOAP note with the date of your session with the client, their name, and ID if there is one. Write the SOAP sections. At the heart of SOAP note formats lies its 4 components, the subjective, objective, assessment, and plan sections. Here is an example using a SOAP note example for nurses or nurse practitioners. Subjective. John reports that he is feeling tired and that he can't seem to get out of bed in the morning. John is struggling to get to work and says that he constantly finds his mind wandering to negative thoughts. Objective. John was unable to come into the practice and so has been seen at home. John's personal hygiene does not appear to be intact. He was unshaven and dressed in track pants and a hooded jumper, which is unusual as he typically takes excellent care in his appearance. Assessment. John presents with symptoms consistent with major depressive episodes. This is evidenced by his low mood, slowed speech rate and reduced volume, depressed body language and facial expression. Plan. Diagnosis: major depressive disorder. Problem: depressed mood. Rationale: John's depressed mood, evidenced by ongoing symptoms consistent with major depressive disorder, significantly impacts his daily life and requires continued intervention. Long-term goal: John will develop skills to recognize and manage his depression effectively. Sign and date the note. At the bottom of the SOAP note, include your signature and today's date for authorization purposes. Securely store your SOAP notes. Once you've completed the entire SOAP note, make sure that you securely store it, ideally within a practice management software. To discover more of our free templates, explore our templates library, which you can find on our Carepatron website linked in the description below. Carepatron is a practice management software known for its comprehensive features and user-friendly interface. Signing up is free. Just click on the sign up link in the description. If you enjoyed this video, don't forget to hit the like and subscribe button for more content like this.